Hey, I'm Sarah, and it's American Heart Month, and we know your health matters. That's why we are talking to Summa Health today. Dr. Pietrolungo, thank you so much for spending some time with us.
Hey, Sarah, thanks for having me. I appreciate it.
So, I understand one of your specialties is peripheral arterial disease. Can you talk about what that is to our viewers?
Sure. So as a cardiologist, we treat a lot of different aspects of heart disease, but one of them, of course, is arterial diseases of the coronaries, but also of the other blood vessels in the body. Peripheral arterial disease is when there's a problem with blood flow to an extremity or to an organ, usually due to plaque, but can be due to other things as well. The thing about it is, oftentimes, if it's an extremity problem, it's often misdiagnosed because it can look like so many other different things.
Can you talk about some of the treatments for patients?
Sure, it all sort of depends on the where the disease manifests. It can be a blood vessel to an organ, it can be a blood vessel to the brain, or it can be a blood vessel to an extremity. And what happens is the muscle or the organ doesn't get enough blood, and it causes the patients many different types of symptoms. Now, as far as treatment goes, the good news is when you treat peripheral arterial disease, you actually are treating coronary artery disease and other cardiovascular diseases. So things that we always recommend, the first and foremost and the most important thing is not smoking, because that is the single greatest risk factor for the development of peripheral arterial and also coronary artery disease. But other things that you hear as well, like healthy diets, whole food, plant-based diets, Mediterranean diet, avoiding high saturated fat food. We know that exercise is really quite protective. Even short bursts every day for 5 minutes that get your heart rate up and your breathing up are sufficient. You don't necessarily have to spend an hour in the gym every day.
Thank you so much. That is great information. If you would like to know more, you can go to summahealth.org/heart.